Hi, I'm Dr. J of Cornerstone Health, and when I treat sciatic pain, I usually combine it with manual therapy. Manual therapy is hands-on techniques, whether it's chiropractic adjustment or a very proprietary form of manual therapy known as TSI here at Cornerstone Health. It's a way of sort of reprogramming your nervous system so that you have better communication between the central nervous system and where the areas are restricted, where you don't have good control over your movements, usually where they're related to pain. I use these TSI methods and chiropractic techniques in order to maximize the benefits to the area. I'm going to demonstrate some TSI techniques. Usually we have some muscles deep in the back of the hip that pinch down on that sciatic nerve that comes from the low back, goes down the back of the hip and down the back of the thigh. That's why you often have pain that's shooting or radiating from the low back down those areas. That's the course of the nerve. Even though the nerve is getting irritated at the level of the low back, it could also be getting irritated deep in the hip. There are some deep muscles in the hip that when the nerve is getting irritated at the spine level and at the hip level, we need to treat both areas to really maximize the relief from that area. So this is a technique that I would use to loosen up the muscles of the deep back of the hip. Going to engage with my elbow. Okay, so I'm just going to sink to the level of that muscle and do some deep back and forth movement on that muscle. I'm bringing the brain's attention to the areas like, whoa, this muscle's been tight. Do I still want to keep it tight? I'm enhancing the communication between that part of the brain and this part of the body where they've kind of lost touch with each other. I'm getting them reacquainted so that you can have more control over this area and you don't have to keep it so tight. So I often hang out in this area for a couple of minutes. That gives it time to really melt, release. You'll feel blood return to the area, the pain will decrease. After I'm done, the patient should feel more movement as well as less pain. The more often I do this, the more it's going to stay relaxed and pain-free.